Nottingham University Hospital's NHS Trust, NUH, was fined £1. 6 million for failing to provide safe care and treatment to 3 infants, Adele O'Sullivan, Kalani Rawson, and Quinn Parker, all of whom tragically died in 2021. This marks a significant precedent, representing the first instance of an NHS trust facing prosecution more than once for maternity-related failures. The fine underscores a pattern of systemic shortcomings within NUH, which is currently embroiled in the largest maternity inquiry ever undertaken by the NHS. This prosecution, initiated by the Care Quality Commission, CQC, the healthcare watchdog, highlights the severity and persistence of these failings. The £1, 6 million penalty follows a previous £800,000 fine levied against NUH in 2023. This earlier fine related to the death of Winter Andrews, who passed away just 23 minutes after birth at Queen's Medical Center in September 2019 due to preventable failures in care. The case involving Kalani Rawson, who died at 4 days old on June 15, 2021, is particularly harrowing. His death resulted from hypoxic ischemic encephalopathy, a devastating brain injury caused by insufficient oxygen or blood flow to the brain. His mother, Elise Rawson, presented at the hospital with concerning symptoms abdominal pain and reduced fetal movements, yet a critical delay in performing an emergency cesarean section tragically contributed to the infant's demise. This delay highlights a critical lack of timely and appropriate intervention, a failure that underscores the wider systemic issues within NUH's maternity services. The repeated failures and subsequent prosecutions underscore the need for comprehensive reforms and enhanced oversight to prevent further preventable tragedies. The CQC's actions demonstrate a firm commitment to holding healthcare providers accountable for the safety and well-being of patients, particularly vulnerable newborns. The substantial fines imposed reflect the gravity of these failures and aim to deter similar negligence in the future, ultimately striving to improve the quality and safety of maternity care across the NHS. The ongoing inquiry serves as a catalyst for systemic change, aiming to prevent future tragedies and ensure the provision of safe and effective maternity services for all. The devastating loss experienced by the families involved emphasizes the profound human cost. The combined impact of these multiple prosecutions and the ongoing inquiry underscores the profound urgency for comprehensive reform within NUH's maternity services. This is not simply a matter of financial penalties, but a critical need for fundamental cultural and procedural change to prevent future instances of avoidable infant mortality.